I am going to be laying a special wreath. It's a wreath that was made by the last speaker, Aaron Alward, who's one of our best activists and a dear friend of mine. And like Chris, I've heard her story before, but when I hear it again, it brings up these emotions. But the wreath that I'm going to be laying is actually a special wreath that was not made for the issue of domestic violence, but for another issue that Aaron has spent countless hours dealing with, and that is the issue of COVID infection in the workplace. Last month marked the 4th anniversary of the pandemic, and on each of those anniversaries, our labor movement organized a memorial. And at that memorial, we laid flowers similar to these, handmade by Erin and her 3 children. And this year, instead of laying the thousands of flowers out, one for each of the victims here in Alberta, people who died as a result of the COVID pandemic, we've decided to put those flowers together in wreaths. One of them will be laid today. And we've chosen to do that today because COVID is a workplace issue. And in fact, COVID has become the 3rd leading cause of death in this country after heart disease and cancer. And we're trying to highlight it today because it has become the workplace health and safety issue that is not spoken of. We've all heard the comments, sometimes from our friends and colleagues, sometimes from our employers, and distressingly sometimes from our government. They say things like, COVID is over, COVID is mild, it's just the flu. But here's the thing. According to Statistics Canada, 13% of Canadians, 13% of our total population are living with long COVID right now. COVID is not the flu. COVID is a multi-system illness that affects our blood, that affects our heart, that affects our brain, our other organs, and it degrades our immune system. Every infection increases the likelihood that a COVID infection will lead to long COVID. COVID is a workplace issue because it affects people in the workplace. In fact, the people who are most likely to be infected and the people who are most likely to suffer long COVID and COVID-related disability are people who contract the disease in workplaces. And as someone who represents working people in this province, I can tell you, even during the height of the pandemic, when many people were working from home, the vast majority of our members and unions affected with it, unions represented by the Alberta Federation of Labour, were actually on the front lines. They didn't have the luxury of working from home. That was true for healthcare workers. It was true for our brothers and sisters and union siblings working in the private sector in places like grocery stores, meat packing plants, and warehouses. But what most people probably don't realize is that the workplace that has become most dangerous in the context of COVID is actually our schools. There is no place where COVID infection rates are higher and where COVID-related disability rates are higher. So that's true for our teachers, it's true for our educational assistants, and it makes sense when you think about it. It is the one place where people come together, often shoulder to shoulder, in classrooms that are growing larger and larger. You've heard from our teachers that the 40 has become the new 30 in terms of our class sizes. That has implications for the quality of education, but it also has serious implications for the spread of COVID and the resulting infection and rise of disability related to long COVID. So COVID is a workplace issue. COVID is a workplace issue that we in the labor movement are paying increasing attention to, and we are starting to advocate more for solutions. And I was very pleased to hear that Peggy, on behalf of the New Democrat Caucus, recognizes that a big part of the solution has to be cleaning the air in our workplaces. And that needs to start with our schools for the sake of our kids. And I, as an Albertan and a parent of children, I am shocked that we would allow our kids, our future, to spend so many hours in that kind of environment when we know that the threats are serious. But I'm also addressing this issue because, as I've said, it is a workplace issue. So we are going to try to make this an issue in the years leading up to the next provincial election. We are going to try to make it an issue in the next provincial election, and we are determined to make sure that COVID as a workplace health and safety issue becomes one of the determining issues in the next election, so that working people in the public sector, in the private sector, and especially in our schools can actually come into the workplace with confidence that they will be that the workplace will be a safe one. So with that, I just want to thank the organizers of this event. I want to thank all of you for coming and sharing in this important ceremony. I also especially want to thank my dear friend Erin for sharing her story, and my friend Jill from the Women's Shelter Association. Today, we think about those who have lost. We think about our obligation to do better and to fight for a future in which workers can come home safely. But especially today, we think about what we can do as a labor movement to end the scourge of domestic violence and to do more to protect our fellow working people in this province in the context of COVID. Thank you for being here.